So today's topic is acute appendicitis. Okay, acute appendicitis. So we will see the histological picture. Okay, so this is the slide usually given to you. It looks like this, and these are the we will see later on about this. First, acute appendicitis. What do you mean by acute appendicitis? It is the acute inflammation of appendix. Okay, it can occur in any age, but most common it occurs in younger and adolescents. What is the pathology? Means before going to that, we will see what is the pathogenesis. There are multifactorial pathogenesis. If there is an obstruction, ischemia or infection, that will lead to luminal obstruction. Okay, luminal obstruction due to fecalith or lymphoid hyperplasia, fecal debris, tumor. Now these will lead to increased intraluminal pressure that will increase the impair the venous return. Now due to that there will be ischemic injury and stasis of the contents is that will lead to bacterial proliferation and inflammatory response. Due to this what is this inflammatory response? Edema will occur and neutrophilic infiltration occur. Okay, these are the cells of acute inflammation. Where will this occur? In the lumen and muscular wall and the periappendiceal soft tissues. Now if this is not taken care of, what will it happen? Gangrene will occur and perforation will occur, which will lead to peritonitis. Now what are the clinical features of this appendicitis? There will be periumbilical colical pain, okay, which will increase in 24 hours, constant and sharp type, and it may migrate to the right iliac fossa, that is McBurney point. Now what is McBurney point? If we draw a line from umbilicus to the right iliac fossa, 2/3 point, that is the McBurney point. Now this pain, all the clinical features that mimics these characters, these diseases like biliary colic, diverticular disease, ectopic pregnancy, endometriosis, mesenteric lymphadenitis, and gastroenteritis. Now what are all the investigations we do for it? We will do the blood counts, leukocyte. We will see that the WBCs are increased because we can see the neutrophilic infiltration. Now urine analysis to rule out the urinary tract infection and especially pregnancy in case of females. And we do USG and CT scan, which has great sensitivity, and we should first rule out the pregnancy before doing this. Next, let's see the layers of the appendix. Okay, before knowing that, appendix is a part of large intestine. So how will we differentiate? If a question is being asked that how can you differentiate between the large intestine and the small intestine, you can say that in large intestine villi are absent but crypts are present, and in small intestine villi and crypts both are present. Coming to the layers of the appendix. Okay, these are the layers. Normal physiological layers. First is this epithelial cell layer. Epithelial layer that contains the goblet cell. Then comes the lamina propria. Then comes the muscularis mucosae, submucosa, muscularis propria, and serosa. This epithelium is the innermost layer, and this is the outermost layer. Now what are the pathological changes? Pathological changes, we can see the exudates in the surface epithelium. Now what is this exudate? This is in the lumen we can see the exudates. These are the inflamed cells like neutrophils, RBC, plasma cells. These are the exudates. Now we can see ulcer in the surface epithelium. Next, in the muscularis propria layer, we will see neutrophilic infiltration and edema, and these are the diagnostic criteria. Okay, and neutrophils, this is the acute inflammatory cells, and this can be found in all the layers. All the layers we can see this neutrophilic infiltrations. But in the muscularis propria layer, this is the diagnostic feature that if we get the inflammatory cells like neutrophils and edema, we can say it is acute appendicitis. And the normal physiological condition means it's that there is inner circular muscles and outer longitudinal. Okay, inner circular and outer longitudinal. Inner circular that contracts and the muscle, and the outer longitudinal maintains the peristaltic movement. Okay. Now the serosa layer has the blood vessels majorly. In this condition, the pathological change is it has dilated, congested blood vessels. Due to obstruction, we just have seen the pathogenesis behind this. So the dilated and congested blood vessels can be seen in this. So if we are being asked what is the diagnosis, this is the acute appendicitis. So here we can see that mother cell or tissue identification in GI tract. We have 4 layers, okay, normally. So mucosa, epithelium, tall columnar, these are tall columnar absorptive cells with goblet cells. Lamina propria has lymphoid follicles. In muscularis, mucosa is the next layer, then is submucosa. In submucosa we can see loose connective tissue and Meissner's plexus. In muscularis propria layer we have seen that inner circular and outer longitudinal layer, and meninteric plexus is present. Ganglionic cells are also seen, and in serosal layer the blood vessels seen. So this is the mother tissue. If we are being asked that how do you know this is appendix, so these are all the features that we can see and say that this is appendix. But the pathological changes or findings for it to be acute appendicitis, it is first is exudation in the lumen, that is the inflamed cells, RBC and plasma, then ulceration of the surface epithelium, then we can see acute inflammatory cells in all the layers, edema and acute inflammatory cells, that is neutrophils, in the muscularis propria layer, which is the diagnostic feature, and in serosal layer we can see dilated congested blood vessels and acute inflammatory cells, because these are present in all layers, no. So we can say that the diagnosis is acute appendicitis. Complications: acute suppurative appendicitis, gangrenous appendicitis, perforation that may lead to peritonitis. Again, this is a picture in which we can see these are the exudate in the lumen, this is the ulceration in the mucosal layer, and then this is the muscularis propria and the serosal layer. So this is all about the acute appendicitis.